I'm Jean Kelscher, and I'm the Director of Education and Vision Services here at the Wisconsin Council of the Blind and Visually Impaired. With me in the room today are Carol and Deb, two people who have vision loss, and will share some of their knowledge and experiences about it. We also have just some embedded stories from three other people, Erica, Heather, and Nona. First is just to sort of think to yourself about if you were told in the morning that your next client, patient, consumer is somebody who is blind. What kinds of assumptions do you make when you hear that word? And a lot of times when people hear the word blind, they assume that people have no vision. But there's a wide variability to the meaning of the word blind. So it's not unusual for many of my clients who have, say, macular degeneration and have lots of peripheral vision but poor central vision. They may call themselves blind. Sometimes people who may have a visual field cut will call themselves blind, and that's okay. It's just to know that there's a lot of different meanings to that word and how people will choose to use that word. And so people may call themselves blind, they may say they have a vision impairment, or they may have low vision. The important thing to try and figure out is the function rather than the label itself. The labels are not the same for people, and it's important to just find out what that means to an individual functionally, with their use of the term or the condition that they have, what that means to them functionally. There's also a lot of variability in how people will respond to their vision loss. There's no one way that you expect a person to respond. Some of it depends on when they lost their vision, how recently that was, might depend on other factors about that person. All of those things will contribute to how a person will respond to their vision loss. And not everybody will respond positively, and not everybody's going to respond negatively. There's a wide variation in that. And also to keep in mind that on certain days, people may respond one way, and on other days they will respond very differently. So it's no different than you or I with anything that's going on in our lives. We will have some variation in how we respond. Keep those things in mind. Not all blind people read Braille. In fact, it's only a very small portion of people who are blind who are Braille users. Not all blind people will use a white cane. Not all blind people are able to comfortably move around in their environment. Always keep that in mind, high variability in what to expect. Probably the best beginning that you can have with any of your people who identify as having some sort of a vision loss is to ask them, how can I be of assistance to you? That's probably the most powerful question that you can ask. And if you listen to how they respond, you will then know how you can treat them respectfully and how you can include them in the activities that you're going to be involved in with that person. So that one question by itself can carry a lot of weight for people. I'm going to play a little bit of a story from Heather, and Heather is a colleague of mine here at the council. She wasn't able to be here today, but she did want to share her story. So I'm going to go ahead and play that. You might have to adjust your volume control on your speakers. There's a few parts in it where she's a little quieter than in others. Okay, so here it goes.
I had good experiences with healthcare. At one point in my life, my son was 1 month old, and that was not a good experience when I took him to a hospital because I felt disrespected when I was in the pediatric room with him, and I had one nurse out of, I would say, 4 or 5 that were there on a regular rotating schedule. This one nurse, she ended up saying in ways that I couldn't take care of my son because of my vision loss, and that made me feel very angry. So what happened when he was in the hospital is most of the time, since he was 1 month old, he was sleeping a lot, and then there were times when I of course, had to change him and feed him, and I was there around the clock as much as I could be. The nurse at that time of the day was very respectful, and he gave me an update of what had happened. And somewhere between 11 and I believe 6 in the morning is when this nurse would come in. That was the nurse that gave me a hard time because of my vision loss. And the first time that I saw her and she realized I couldn't see well was she said, "Well, I hope you're aware of where these cords are." And I said, "Well, yes, I am." And the cords were there because my son was on oxygen support. That was the only reason he was in the hospital, was just for oxygen support. One nurse, and she told me that about the cords, and I said, "Yes, I know." And I had been there for probably 2 days. Then the next night she said that she wanted to talk to the nurses, and she wasn't sure if everything was going well, and I said yes it was. And then I believe by the third time she ended up saying to me, "Well, I'm still not sure about all this, and maybe I should put like a bracelet on your son, and possibly you letting all the other staff know that you have a vision loss, and other nurses, need to come in more regularly and check on how you're doing." And at that point, I was very upset. I just told her that at that same moment, I said, "Well, you know what? I'm sorry, but this is making me really frustrated." I said, "I have a 5-year-old son that I take care of. I have a husband, so I have a family, and I'm a member of the community as far as I do volunteer work and I work." And I said, "So I am just like anyone else, and I'm doing really well with all of these other things. And just because I don't see well does not mean that I'm not taking care of my son here at the hospital very well or anything else in my life." And she finally said, "Oh, well, I guess everything is okay." So the nurse that felt that I wasn't doing well with my son or was concerned about my vision loss, she did not announce when she came in. She would just go over to him and take his vitals and look at the oxygen level, and she would write it down or whatever she needed, and then she wouldn't say anything to me except for some negative things. And that's what made me feel uncomfortable and disrespected, is how she wouldn't really talk to me. The other nurses, I felt, did a really great job because they would knock or they would come in and they'd say, "Hi, I'm Sally," or whoever, and I'm just here to take care of your son as far as check his vitals, check the oxygen level. That nurse would tell me that, "Oh, I'm taking his temperature," and then the nurse would tell me what the temperature was, and then either I would ask or the nurse, most of the time, would just tell me that what the oxygen level was. They kept me updated on his progress as far as when they thought he might be able to be off the oxygen, have some time in the hospital to breathe on his own. And I just felt that those nurses did a great job, and I was comfortable. I felt like everything was going well because it didn't matter with my vision loss. I felt that it was going well because they were friendly and they told me what was going on. The nurses made comments as far as they would say, "Oh, I really like how you hold your son," or "He seems to really like you holding him in that way," or "He seems very content, very happy," and just some really positive comments. And I really appreciated that.
That was Heather talking a little bit about her experience, which, shows just how very, very simple things that are done can really make a difference in how she felt about her experiences when she was at the hospital. Just that simple things like identifying themselves, letting her know why they're there, what they're doing, making sure that they're communicating all of that to her made a very big difference in how she felt about herself and her role and how she was doing in that situation as a stressed out parent. Just your language and communication can make a big difference for somebody under those circumstances. And it's okay to use words like look, see, and read when you're working with someone who is blind or visually impaired. Those are not things that you have to take out of your vocabulary. They are used just regularly as you would with any person that you are to see. We're going to talk a little bit about interactions here, and I think Carol is going to tell a little bit of her story here.
Hi, this is Carol. I am a retired school psychologist, and I have been dealing with my vision loss for about 5 years and have been totally blind for about 4 or 5 months now. What Heather said about feeling disrespected is really important, and you don't want to be patronized, but you also don't want to be disrespected. And it's difficult if when you're in a room with someone and they find out that you're blind and then they talk to the other people who are in the room or think you need to have someone with you because you can't take care of yourself, that can be really make one feel disrespected. But I was in the hospital, and I did find for about 4 or 5 days, and I did find that there were some things that would have been really, really helpful to me from the service providers, from the nurses, the aides, even the custodians. One of them was what Jean said about identifying yourself when you come in, and sometimes identifying who you're speaking to, too, because sometimes there'll be more than one person who comes into the room, and if someone just starts to ask a question, you don't always know that if you can't see them looking at you, you don't know they're speaking to you. So it really helps if you use that person's name, like Carol, it's Sally, and I'm coming in to take your blood pressure, or I am going to give you a new bag of saline. Just identifying what you're doing, and it also helps if it's going to be somewhat of a process that you explain what you're doing as you do it. First, I'm going to such and such, and then you'll feel this, so on, so forth. Another thing that I found would be really helpful is if you have a button that you can, a raise button, that you can put on the call button for the nurse. We tried to improvise, and sometimes it worked, sometimes it didn't, but I wasn't able to see if that light was on or not. There were times when I really needed the nurse, and she didn't know I needed her. Another issue that I had to deal with was the room orientation, knowing where things were in the room. If you're moving something, if you're moving a table, or if you're moving objects off a table, to let the person with the vision issue know that you are moving them and telling them where you're moving them to, or letting them at least touch and feel where you have moved it to, so they have a sense of where that item is located at this point. Oh, I'm sure there's other things, but probably the biggest thing is to just help them feel respected, because people who are dealing with vision loss or any kind of a challenge need to know that they are as important as anybody else that you're working with. And even if they may take more effort on your part, they're also having to give you a lot of focus and attention, very focused effort to sometimes understand what it is you're wanting them to do.
Probably be coming back to some of the experiences that you had. So just to say a little bit more about being descriptive in the interactions that you have with people is to make sure that you explain exactly what it is that you're going to be doing to or with someone prior to doing it. And Carol's examples were given while she was at a hospital, but that would be true if you're in their home or if they're in your office. Any place that you are interacting with somebody is to make sure that they know what is going on around them that relates to them, and to be fairly precise in the instructions that you're giving. Sometimes it's appropriate to also hand them whatever it is, if there's an object that you're going to be using, so that they can get a sense of what it is that you're doing. So like if it is in a hospital situation and you're applying some sort of a sensor to them, is to let them feel it before you were to attach it to them, letting them feel it, giving them as much information about it as you can, and then making sure that you ask if there are any further questions that they have prior to you implementing whatever that procedure is that you're doing. When you're giving directions to people who are blind or visually impaired, you need to be fairly specific in what those directions are. Saying things like over there are not helpful. Over there is a pretty big amount of space. For almost all of us, if we could not see and were put in a room, we would have very quickly lose our sense of even where right and left is. So it is important to be precise in any instructions that you are giving. It's also very helpful to ask permission or to tell the person before you're going to touch him or her so that they know that you are approaching. Many people have a sense about who's close and about how close you might be, but they may not know that you're reaching out and in a split second you are going to have your hand on their arm, for example. So just make sure that they know what is happening within the environment that they're in to keep them as comfortable as possible. Our next section is on human guide, but I think I'm just going to stop for a second here just to see if there are any questions that anybody might have and want to ask of any of the information so far, or if you have other questions to ask of Carol. Feel free to write those in the chat box or to use your mic and just hit your control button. I will turn the mic over to anybody who has a question.
The call lights for when I was in the hospital, if I had known, I would have put a raised dot on the button that calls the nurse. And then when you're feeling for what button do you push, immediately you know which one it is. And you know if you push it down, you can push that button firmly and the light should go on. I've been in the hospital several times, but never as fully blinded. And oftentimes nurses will, someone from the desk will say, what can we help you with or whatever. But if you can't see and you don't know whether someone knows you need help, it can be frightening, especially if it's somewhat of an emergency and you don't know how to get around the room that you're in. It can be really frightening. So it's good to have a definite way that that person can get a hold of you and make sure that if they're calling you, that at least the light is on outside your room. I hope that helps you.
One of the things that I've also observed that we often don't appreciate is that all call buttons or call systems are different. So I was recently at a assisted living facility and the call button was just like a little plunger, and at another place that I was at, the call button was incorporated into the television remote, which makes it even more difficult for somebody to be able to know exactly which button it is they're going to be pushing. So it is important to orient people to any of that electronic equipment that might be in their space and make sure that they know what the buttons are. And as Carol said, if there's any way that you can add a raised area or a roughened area to the most important button, then to definitely do that. Any other questions or comments that people have? Okay, don't see any, so I'm going to go ahead and move on to what's called Human Guide. It used to be called Sighted Guide, but now they call it Human Guide. And I'm going to start just by reading a brief story that Erica sent me. Eye doctors' offices, ironically, are really notorious for saying and doing crazy things, like dragging canes and assuming you are incapable of doing things on your own. No matter which doctor's office I visit, I tell the nurse bringing me into the office to just give me left-right directions. I also tell them to just keep talking so I can follow. Erica's figured out some key things that she can say prior to going into a doctor's appointment so that she feels that she has a better sense of where she's at and in the space that she's going to be in. Human Guide is probably a key skill to just have at hand. And when you are working with someone who is blind or visually impaired and you want them to go from point A to point B, one of the easiest ways is for them to take a hold of your elbow. and they're going to be walking about a half or one step behind you and to your side. You just have to comfortably move forward. You'll be able to feel if they can keep up at the pace that you're setting. That's pretty easy to do as the lead person, so that if you feel like you're kind of pulling the person along, you're probably walking too fast. If you feel them leaning into you, then it is important to slow down just to make sure that they're able to keep your balance at the pace that you're setting. They're hanging onto your elbow, and then they're going to walk along with you. You then need to be sure and give them information about the area that you're moving through. If there are objects that are going to be in the way, that you're going to swing one way or the other in order to avoid, you want to tell them that. Not because you expect them to swing out of the way, but just so that they know why you're going to move all of a sudden to the left or to the right when they were expecting you to just keep going forward. So make sure that you give information about what's along the path. It's also okay to also mention other cues that might be in the environment to help them better understand what's going on. If you walk past a door and there's a lot of noise that's coming out of that door, you might want to mention that that's a door that parents meet their kids in, or that's break room for other employees, or for some reason that's always going to be more of a noisy area. People may be able to use that information at another time that they're visiting your space in order to better know what happens there. If you're going through a door that you're opening or closing, you want to mention to the person that you're guiding if the door is going to be on their right or on their left, so that they will have some sense of whether or not they're going to have to catch that door and how they might want to catch it. And the person will generally, who's done this, will know what they need to do in order to safely catch onto that door. If there are any stairs, you just pause at either the top or the bottom of the stairs, and you want to say to the person that there are steps or stairs. You don't have to count the steps for them. You might want to say there's a lot, or if there's just two and you can easily see that, you might want to mention that. You definitely want to tell them if there's a railing and ask if they would rather use the railing. Otherwise, you're going to proceed up or down those stairs, and again, the person will be one step behind you when you're going up and when you're coming down the steps. And there you do want to go slowly so that the person does have the ability to keep up with you and stay safe on the steps, particularly if they're hanging on to your arm. When you get to the location that you want to go to and there's a chair, you want to make sure that the person can get themselves into the chair. So you walk up to the chair, you tell the person that you're at the chair, they will slide their hand down your arm onto the chair. And you tell them if it's the back or the arm of the chair, then you move away. Once their hand makes contact with that chair, then you can move to the side. And they can feel that chair to know where the front of the chair is going to be and orient themselves in order to sit down in it safely. If the chair happens to have wheels on it, stand behind the chair. So if the chair slips going backward, that you're going to stop it from moving away from the person and them falling on the floor. Once a person is in a chair, they're pretty good about then being able to just kind of figure out if there's a table in front of them or what's going to be in front of them and check it out with their hands to get a sense of what's on the table. Just a few words about people who carry a mobility cane, and that's the white cane with the red tip. That is a long cane, and that people will have that out in front of them. The mobility cane is used both with and without human guide. Oftentimes, people will continue to use their cane even though they might be hanging on to your elbow. So they might use the cane to keep track of what's happening on that outer edge, that they can't see anything into that side. So they'll kind of take care of that side of it. They might use their cane to check the height of a stair so that they know approximately how big of a step up or down that stair is going to be. They will continue to use their cane. Often if someone has a support cane, they're not going to be using the cane a lot for identification of other objects. They're not using it to give them a lot of information because that cane is being held directly to the side of them. And so they're not going to get a lot of information if something is in the way or if there's a person that they have to walk around. Keep that in mind, that the support cane is being used for support. A mobility cane is not used for support. It does not have the stability or strength to hold somebody up. There is an intermediate kind of a cane which is called an ID cane, and that is just a small cane, usually 36 to 40 inches or so. It's lighter weight than the mobility cane, and people use that to identify themselves as someone who has a vision impairment. The ID canes in general are not used to guide themselves through the environment. They're not long enough to do that. But they are helpful, like when traveling at an airport, for example, to let airport personnel know that you have a vision impairment, may need assistance with boarding or getting from one gate to another. They're helpful in restaurants to alert wait staff that you may need assistance seating, finding a table, knowing what's on a menu or a menu board. So it's letting public know that you have a vision impairment and may need some assistance. And the other thing to mention about guides are people who are blind or visually impaired who have a dog guide with them. The dog is working at the time that they are with the individual. The dog is in harness. As a bystander, you should not talk to the dog or reach down and pet the dog, and for sure never feed the dog. When the dog is working, they do need to pay attention to what's going on in the environment and take care of all that they need to be doing that's part of their job. You can always ask the person with the dog if you can pet it. If you can't resist, then it's up to the person to either take the dog out of harness so that you can do that, or just to say, no, not at this time. But always respect the dog when it's a working dog. A little bit about orientation and organization within your space. Nona is someone who is has been on our board, and she had hip replacement surgery. And she found it very odd that when she went to rehab, they really wanted her to move around, and they had her moving a lot, and that was part of the plan. But as soon as she left rehab, the people on the floor that she was on told her not to move around. So they did not want her moving. They told her, we don't want you banging into walls, and she remembers that exactly as what they were telling her. And Nona has very good spatial relations. She has a good sense of where she's at in an environment, and she is a safe explorer of a new environment. But when she was outside of rehab, they did not want her up and about, and no one ever showed her around the room that she was going to be in so that she could figure out that space and better know where things were at. Carol, were you going to talk a little bit about your experiences with space?
The difficulties I had with the orientation were primarily related to the location of the bathroom in my room. And because I was attached to an IV machine, that further kind of limited my mobility. But knowing how to get to the restroom, especially if there's no real reason that you can't go to the restroom by yourself, is difficult. And again, it can be extremely frustrating if you are trying to find that spot and you have had no instruction as to where things are. And I was thinking when Jean was talking about the describing places to others, talking about the restrooms again, I was recently at the UW hospital and used a restroom there, and if someone hadn't been there to help me, I'd have never found the soap because it was about 5 feet up on the wall and much higher than I would have expected it. So if you are guiding someone who has, even if they have some vision, sometimes especially in places that are all white and the fixtures are all white, there's no contrast there for them to help pick out where things are. Give them a little bit of a heads up. Okay, the soap dispenser is going to be to the right of the sink and the towels are to your left. Things like that are always really helpful with orientation.
I often have people say that there's no two bathrooms alike, and that is one of the hardest things to sort of figure out what's going on. Let me say a little bit about when you expect people to take in information that typically is given on paper. What are some of your options for doing that? Some people will use large print or magnification. Some people will use audio. Some people will use Braille. But it's important to find a way that they can have information and take information with them so that they can review that information, reread it, share it once they're no longer in your presence. So you need to figure out ways that you can do that. And if you can put your standard forms in a digital files, that can make things very easy. So the slide here just shows some pictures with a basic iPad, and with an iPad you can make things bigger, you can zoom, you can turn on a reader, you can invert the background to make sure that you have things available in alternative formats for people. If people are using large print, then you want to make sure that you have good lighting available so that they can actually have a chance at seeing what it is that they are reading. So good lighting is good task lighting. So lighting that comes down low over what it is that they're trying to read is most helpful. And if you want somebody to sign something, use a signature guide. The signature guide is just the size of a credit card with an open space so that people can write inside that open space. You can also just take a dark pen and make the signature line bold, and people will be able to find it. You can put your finger at the beginning of the line. If you want people to complete forms, is to offer a reader who scribes the person's response, but the scribe needs to know that they need to write exactly what the person says, not interpret what they thought they heard, but exactly what the person said. I wanted to get to Deb's story here.
Good afternoon. This is Deb. I appreciate the opportunity to chat with you about my lifetime of having low vision and to reinforce some of the ideas that are being presented here today to kind of help ease the way for those of us that have low vision. I'll be speaking for maybe 8 or 9 minutes, and then I'll pause just to see if anybody has any questions for us. I worked at the university here in Madison for over 20 years, and whenever we would build a space or a website or forms, we tried to keep in mind how this might affect people who would be using those things, and to make it equal access as much as possible. There's a term in the disability field, universal design. It really benefits more than one person, namely those with disabilities. And of course, the classic example is the curb cut that was built for people with wheelchairs, but it benefits all sorts of people. It makes a big difference. For me, my vision the deficit came on gradually over time. I was starting to lose some of it, and then at age 16, I was diagnosed with my condition. It's retinitis pigmentosa, or RP. It causes central vision loss, and there's kind of a lot of missing information and loss of depth perception. This makes it necessary for me to have lots of light and contrast for things, as has been mentioned before. In the non-medical realm, I've had mostly positive experiences and a few negative. For example, in a store, I might ask where a particular thing is, and the person at the store whose job it is to help will say, "Oh, it's over in aisle 4." And then I think, well, can I find aisle 4? And if I explain what my limit is, I've been pleasantly surprised how many people will physically take me over to that space. One negative experience I had was earlier this year. I was visiting my dad in a rehab center. He was post-surgery and a director. And so I mentioned to the receptionist that I wanted to talk to that person and that I had impaired vision. So she enthusiastically leaped up and grabbed me by the elbow and forcefully pulled me to the director's office, opened the door, pushed me, and said, here he is. So was her intention good? Yeah, absolutely. Was very kind. She wanted to help me, but the way in which she helped me was not very respectful. I was surprised because here's someone who you'd think would have sensitivity training, who's right there in a health center and who deals with people with disabilities all the time. So I was surprised at that lack of understanding about what would be helpful in that moment. And that reinforces the idea that's been brought up already about the idea of respect and dignity. You know, when she did that, it was embarrassing for me. It felt parental. I'm 62. I mean, I don't need to be dragged somewhere. So it was something that I would like to give some feedback to them about. In the clinics, on the other hand, more medical settings, I've had mostly positive experiences, especially if I'm at a new department. The receptionist might hand me a form and say, here, please fill this out. And when I explain that I can't read that standard print, then they'll say, oh, okay, we'll just take that and give it to the nurse and she'll help you fill it out, which is great. But we haven't quite come into the fully accessible age yet, because never once have I had a receptionist say, oh, would you like a large print version of that, which would really be pretty easy to provide, but it doesn't seem to have occurred to them yet about it. And sometimes also they will anticipate a need and they'll say, oh, well, do you need some help getting to the room? And I said, yes, thank you very much. And if it's just a short ways away, they might say something like, well, can you see the bubbler or that plant that's down there? It's just to the right of that. That's very helpful. But if it's really complicated, then if they'll be a guide and take me to the room, that's great when that happens. Another topic that is related to this is signage. I'm pretty surprised at how bad signage is, and I know it's not just me because I've had fully sighted friends and family complain they're tooling down the highway and it's like, wait, that sign just said, I'm not sure which way to go, or I can't find this building, or where's the department within the building? And this would be a relatively simple and relatively low-cost way of making things easier, not just for those with visual impairments, but really everybody. Having frequent signs, you know, that are nice and obvious, well-lit, nice contrast, not too busy or not too fancy. And then they're not just flush against the wall, but maybe sticking out at right angles so that people can see those. The other area that comes up in the same realm is electronics. That can be very difficult to manage, and often when people are programming or setting up websites, they do not take the needs of those with visual impairments into mind and the adaptive equipment or software that we use. Just yesterday I was on a website and trying to navigate a wellness place that was led to reimbursements for inside the health insurance. And so I had a sighted person with me, and we pulled up the website and could not find the field that I was supposed to enter the information so that I could apply for that reimbursement. So just kept looking and looking. I thought, well, maybe it's the weirdness of my software because it's got an unusual color scheme, and sometimes things that would appear on a normal screen just are going to disappear there. So finally, after a frustrating period of time, we called up the insurance company and said, can you help us navigate this thing? Well, as it turned out, they gave us the wrong website. So, you know, it wasn't even an impairment-related problem. They just gave us the wrong thing. But having images that are clear and simple and straightforward, that take adaptive technology into consideration to try to help make that happen, all of those things can be really helpful. And also having a person available, so if it all breaks down and your best efforts don't work, having someone that's on the phone that you can call up and say, you know, this isn't working, can we please get this person who can help walk us through it? That can also be really helpful if the usual ways aren't working. So I just wanted to summarize that building in accessible design so that people can get at it no matter what their impairment is, that there are alternative formats for getting a hold of print or braille or digital formats, having things well lit, having the spaces set up so that people can maneuver, that contrast is available to them, and to anticipate what somebody might need, but to not make assumptions about what they need, and to be sure to ask in advance. to keep electronics simple, to think about what are the implications for adaptive technology, and if you have any influence in that area as websites and things are being developed, to lend that kind of input at the time of development, because it's tougher to change it later on. And to just have that reminder about the dignity and respect for someone so that they understand they're having equal access and being treated fairly in it. So I think I'll just pause there and see if there's any questions.
Okay, there was a question that came up about, could you talk about lighting just a bit more? What is well lit? So Deb, do you want to talk about that from your perspective, and I can say a few words from mine?
Thank you for asking. You know, it really has a lot to do with the nature of the room. I mean, you can have oceans of light that's flooding in, fluorescence and so forth. Sometimes that actually washes things out. So having options or choices, so instead of washing out a room in light that might actually cause more problems, to be able to have some task lighting, or to be able to turn it up or turn it down so that you could customize it to the person's needs. Having, you know, individual lights, there's some great options that I found here at the council to specifically light a particular thing, or a lit magnifier. And I meant to mention before too that I'm a baby boomer, and as we age, there's going to be more and more of us who are going to be needing to have this kind of understanding and these sorts of services and you know, tools at the ready to help us do this thing. So it could even happen to you or somebody that you love, that, you know, as we get older, that need is going to rise up.
Deb mentioned the task light again, and typically a task light is a light that's about 10 to 12 inches away from the work surface. So if you're sitting at a desk and somebody is, and you're going over paperwork with someone, you would want a light on your desk. The ceiling light may be adequate for your needs, but it may not be adequate for someone who has low vision. The task light should be about 10 inches or so off the table surface. You don't want covering on the light that makes the light shine back on the person. You want the light to be directed down at what it is that they're trying to see. There is no hard and fast rule for what kind of bulb you should have in there. In general, my experience is that people do a little bit better with the higher Kelvin values of bulbs, because that gives you a little bit more of a white light rather than a yellow light. But as soon as I say that, I know that I have a couple people whose eyes are very sensitive, and those bright lights are too much for them, and they do happen to like and work better under the yellow lights. So to have some flexibility in lighting, and there are tabletop lamps that will move through different lighting strengths, so you can have a yellow colored light, and if that's not working for someone, you can bump it up so that you have more of a white light color. We're seeing more of those as we go along, and as we transition from so much of the compact fluorescence to more of the LED options. One of the last things that I wanted to say a few words about is that the American Foundation for the Blind has an ADA checklist for healthcare facilities and service providers that is available online, and this website will come to you in resource listing for today's webinar. The checklist goes through all aspects of somebody coming into a building, meeting with people, having things done, paying for services, getting out of the building. So it covers everybody from the receptionist to secretaries to doctors or counselors, and it identifies barriers that are often faced by people who might be using those services or facilities who are blind, deaf-blind, or visually impaired. They also give a range of solutions that can help eliminate or minimize those barriers, and then they do encourage facilities to create a plan of action to ensure access to services and facilities. So that it's one thing to point out what you don't have, but it's another than to take that next step and actually begin to implement some of those actual changes. The solutions that they suggest, a lot of those are, most of them are not costly solutions. A lot of them have to do with how staff interact with people, and asking that question that we started all this with, of how can I be of assistance to you? or what kind of assistance do you need, and let the person guide how they're going to guide your interaction with them. That's our content. The webinar will be archived, and I will send out a link early next week that will have the archive version along with the resource list. So I'd like to thank you for attending today's webinar. We will have another webinar in November, which will feature, November 1 traditionally features new things that are in our Sharper Vision store, so it's more product driven. This year we'll be looking at a couple of the higher tech devices that have come out to help with reading, like the Orcam glasses. Thank you for attending. Have a good late afternoon and evening, and we hope to see you back again in November or next year when we have another set of webinars.